Good afternoon, all of you. This is Dr. Ruchi Shirudkar, founder and director of an organization called as Pediatreat. So today, on the occasion of Doctor's Day, first of all, I would like to wish you a very, very happy Doctor's Day. And I really, really wish that you get all the success in your life and you really work hard and you are able to cure all your patients and you get all the happiness, right? So I'm going to share a case today. The case is about a lady. She's a homeopathic doctor. She lives in America. So she called me around 2 years back and she was saying that I'm having a severe headache. She was getting severe migraine attacks and very, very frequently. And her son was my patient, and this was during COVID when it has initially started. So she said that I'm getting these severe attacks of migraine, and when there is an attack of migraine, there's a severe headache and I get post-auricular pain. कान के पीछे दर्द होता है बहुत, and at that point of time, I'm not able to do anything, right? So there is a state that the pain is so severe that I cannot do anything and I feel helpless, and it has become 3-4 times and I don't know what to do. So I thought of contacting you. And I said, okay, is there any stress? Because it was directly migraine. So she said, yes, there is a stress. We are stuck in America and I really want to go home. The flights are not there and I'm missing home a lot. And my father-in-law is not keeping well and I'm really worried about them because my mother-in-law is alone at home, and my husband has also got COVID and he's admitted, he's quarantined at a quarantine center in America, and I don't know what kind of facility he's getting and things like that. So, and I'm feeling really irritated and worried and I really want to go back home. So this was her full stay. She's always contacted me for her child, and the child has responded well with the medicines whatever we have prescribed him. And this is the first time this lady is contacting. I said, anything else that is bothering you? She said no. So this is the case, right? A lady living in America, stuck in COVID over there. She wants to come back home. She's worried about her father-in-law who's hospitalized, mother-in-law who's alone at home, husband because he's in a quarantine center during COVID. And so these are the main thing that she's worried about. I've written her case. Okay. And she's getting a severe migraine attacks and post-auricular pain that she's getting. With the pain, she gets severe nausea. Sometimes she vomits and sometimes she is not able to vomit. And so the pain is so severe that she wants treatment for it. This is the case. So what remedies you think about and how will you analyze the case? Why I am taking this case specifically today, normally I take remedies, is because we are conducting a webinar on analysis and evaluation. So that is one point that I want to make here to all the homeopathic doctors. Ki jab bhi, whenever there is a case in front of you, you will see 20 symptoms coming in front of you. Like here the lady is worried about her family, she wants to get back home, there is extreme pain, intolerable pain, during pain she's helpless, she's not able to do the work, so there is work impossible or business incapacity for, and ailments from cares and worries. So you get all these symptoms, right? So you may get 10 symptoms or 15 symptoms, but solving a case is like a jigsaw puzzle. You want to put the right thing with the right, and you have to do that connection and come to the right remedy, which is very, very important. Why we fail most of the times is because we take a case and we know some part of the case. And we say, okay, this is extravagance and this is fear extravagance, and we give opium. But we do not see case as a whole. We have to take the case as a whole and take everything that the patient is telling us. And then from those 20 rubrics, you have to pick some things, which is most important in your case. So receiving a case and taking the full case in totality is very, very important. And then evaluate, pick those symptoms very that you feel are very, very important. So after seeing this case, is there anything that you feel is very, very important in this, and what kind of remedy you will give to this person? Right? So I'll wait for your answers, and then I'm going to tell you what I gave to this patient, right? And then in short, we'll discuss that drug. Okay? So anybody who wants to contribute? So as I told you, let's see what all comes in this case. Is there is ailments from cares and worries, there is cares full of others about, where she's she's worrying about anxiety over loved ones, where she's worrying about father-in-law. Then what was most important is in this case was that she's stuck in America, she's missing people at home, she wants to come back to India, which she's not able to do, right? So she's worried about a child, her husband, and the most important of all this is that she wants to come back home. So what struck me in this patient is homesickness, right? And now if you look closely, so homesickness and migraine with post-auricular pain. What she was saying कि कान के पीछे दुख रहा है. She specifically told me कि I have a severe pain post-auricular, right? So mastoiditis with homesickness, if you connect these two, rest all becomes secondary. So if I connect these two ailments from homesickness with pain in mastoid bone or headache, there's only one remedy that classically comes together is capsicum. So I prescribed a capsicum 200, 3 doses, and after that she was absolutely fine, no headache, nothing. She came back to India after 1 or 2 years. Then also she contacted me and she said that she's doing much, much better. So, she didn't, the patient will not come and directly tell you that this is mastoiditis and I am homesick, so you give me capsicum, right? So she gave all the data. You could have confused it with ailments from cares and worries and everything, and you would have given cocculus also, right? So I'm not saying cares and worries are not there, but what was primary in this patient was that she's worried about him, but she wants to come back home. And this concomitant which she was getting is classic, that she was getting a pain in the mastoid bone. She didn't say pain in the mastoid bone. She said kaan ke piche dukh raha hai, and I'm feeling homesick, and I'm worried about everyone in the family, and I want to go back to India. So if you connect all this, the only drug that will come, we call it as qualified mentals. When you get a physical modality to a mental complaint, the homesickness with mastoiditis, it is classical capsicum, So I prescribed her capsicum, and she did really capsicum that I used in my clinical practice. One which is very, very important in pediatric cases. I have shown lots of cases of capsicum in my seminars. I'll tell you one. If there is a child, first is homesickness. It's a primary remedy for homesickness that you cannot forget. So first is homesickness. Second entry for capsicum is if the child is sitting in front of you, and you suppose the child's name is Arya, okay? I'm just telling for example, and you're asking, I'll imitate like a child, okay? So if I'm asking, Arya, tell me, how are you? Arya, tell me. No matter how much you try to coax the child to talk, there is absolutely no reaction. He's not shy. The child is not timid. The child is just like, आप पूछ लो, सर पीट लो. You just keep on trying and trying. Parents are also like, batao, doctor is asking, Arya, talk. The child will not utter a word, but with that, there is no timidity. Sharmane wala sharmaega, he will look down, mama, will do like this. But this is dheet, we call it in Hindi, adiyal. It is obstinacy. There is absolutely no reaction from the child. You will see lots of patients. I have cured molluscum to asthma to so many diseases with just this reaction of a child. Put it directly into your head when you are asking the child, and the child is absolutely thanda. जिद है भैया नहीं आंसर करना, उखाड़ लो आप जो उखाड़ना है। आप पूछ रहे हो बेटा क्या हुआ है, इज देयर हैपनिंग, हेडेक हो रहा है क्या, खांसी हो रही है क्या? The child will not even look at you, will not even smile at you, will not even say, no, I'm not going to answer. There is absolutely no reaction from the child. Are you understanding? So there is a rubric: obstinacy, children in chilly, refractory, and clumsy. Right? Chilly, there is a chilled response. There is absolutely no response from the child. And the only remedy in this rubric is capsicum. So it homesickness 1, second, if the child बैठ जाए आपके क्लिनिक में and the child is just not ready to talk, when there is no timidity but the child is aerial and he doesn't want to tell you or even look at you or even respond at any of your questions, think about capsicum as the primary remedy. Third entry point, I have not used capsicum like 100 200 cases, but whatever cases I have used, it has done wonders to that cases. So I'm going to try to tell you these 3-4 entry points of, I always tell like entry points of a remedy. I'm not the one who would create ऐसा होता है फिर ऐसे करता है. That is not my, that I don't get that way, So my entry points are usually what we see in the clinic, right? So another entry point is they are lazy and they do not want to get away from their routine. जैसा चल रहा है ना अच्छा है, सुबह उठेंगे ये करेंगे, सेकेंड ये, थर्ड ये, they want to do the routine, they do not want to. तो chilly people, fat, flabby, you will see the nose tip ready or the cheeks are red but they are not burning, they are cold to touch, they are chilly, इतने chilly होते हैं कि उनको they have fear of a draft of air, they have fear of cold air, they have fear of open air. तो उनको डर लगता है क्योंकि उनको ठंड लग जाती है, नाक ये सब लाल हो जाता है, So and they are lazy, Even in children, one thing also I have read in Materia Medica, I have told you about their obstinacy. They are so obstinate कि even if suppose the child is crying for this remote, right, and the child wants this remote, but if you offer the remote, they will not take. Kent has written about it that they are so obstinate, even if what they desire you offer, they refuse to take it. Zid hai, dheet hai, right, and lazy hai. They don't want to study. They don't want to, they want to get things with minimum amount of hard work. They are not very ambitious. Are you understanding? So these homesickness, obstinacy in children, and third is laziness. These are primary entry points of capsicum. Then we have homesickness with NOE, homesickness with suicidal disposition, homesickness with irritability, red cheeks with, hot fosses with. So अभी आपको patient will never say कि I have I have heat in my throat or my cheeks have become red and I am homesick. You as a physician have to connect these dots that patient gives you, right? So in this case also I saw homesick and that is why I prescribed capsicum. So every case there are 3 steps, First, receive the case. Second, analyze the case, make proper rubrics. Third is evaluation. Give value to your rubrics. Understand which rubric is important and which rubric you can neglect in your case. And that is very, very important. Without giving value to your rubrics, sometimes you take rubrics which are not important. For example, every case laughing you give belladonna, or every case which is frivolous you are giving. It is not that easy and it is not that difficult also. If you understand the core of the patient, there is no strict rule ki it is not always the mathematical totality, but sometimes yes it is. It is not always the feel of the patient, but sometimes yes, you get the feel of the patient. So sometimes you solve the case by a single rubric, right? And sometimes, so you understand what is the main key to come to the correct remedy is the core. You understand the core. बाकी तो पेशेंट 20 मिनट बोल रहा है तो कुछ ना कुछ रूब्रिक हर सेंटेंस पे बन ही रहा है, right? So you don't give importance to those and you give importance to the main core feeling of the patient, right? So we are conducting a 3 days webinar on analysis and evaluation. It will be 2nd July 2022, 2nd, 9th and 16th July. I've already closed the registration for it, but I want you to learn how to analyze and evaluate a case, and to don't make fixed images about remedies. Be open, and always before prescribing, think for a moment that, what is bothering the patient most, and then prescribe. And one very important announcement that I want to make, that in August 2022, in the mid of August, I'll be conducting a 2-day seminar where I want to do I've been doing these webinars, we are doing it online, but this time I want to do a physical seminar where I can meet you all, we can sit down and discuss, and, it is a different feel altogether when you connect physically. So it would be my first physical seminar, because I have always worked under someone. So I'm very, very excited to meet you all. Those who want to register, it would be a 2 days webinar. I would be telling all these details very soon. We'll be finalizing a place, and I'm looking forward to meet you all, and together we do a very good practice and cure patients and make others happy. That is the main goal that we have. So thank you all. I hope you analyze every case, give value to your symptoms, think before you tell a remedy, don't be prejudiced, and wish you a very happy Doctor's Day. Thank you.